At the World Bank, most of my work was really around leading country engagements to improve primary healthcare systems and to strengthen the primary healthcare systems in countries in Africa, in South Asia, and in the Pacific Island regions, and also some in South Africa, in South America. And what I've seen is that cardiovascular disease, it raises a lot of health challenges. It's definitely a health issue on its own, and it presents significant and growing challenges in all these regions that I just mentioned. But what I think it's really important to flag is that they all present unique challenges. Nutrition, I would say, is the cornerstone of public health. I like to say that. Maybe other people will disagree, but maybe I may be partial. But the reason I say that is because we are really what we eat, and everything that goes inside you really manifests in different ways, whether it's health-wise or whether you become like maybe sick or diagnosed with an ailment. In Nigeria, where I deploy nutrition education for vulnerable population through the primary healthcare center, I use the primary healthcare center to say that the primary healthcare center is really the first point of care for many of the vulnerable population in many countries, in low and middle income countries, and even in lower income countries as well. And so if we're able to integrate nutrition services into the primary healthcare systems in a way that it's accessible to the population, then at least we're confident that we're reaching the people that really needs to get that education. And so integrating nutrition awareness and education in the primary healthcare system, whether it is during antenatal care services, then you're able to get to the mothers when they're still pregnant and then teach them about nutrition. But again, from the work that I've seen, I know that nutrition education is not really enough because choices really, it depends on what is available to you. So it's good enough that you have the nutrition education, but you also have to be cognizant of the fact that our food systems are somewhat failing us if we're being honest. It's more expensive to get healthy food than it is to get processed foods. And so in many of these countries, like I started in my opening remarks, processed foods have become like the go-to. There's a lot of high intake of sugar, high intake of salt from processed foods. But then again, there is this mindset shift that needs to happen, that processed foods is really bad for you, and we should be eating not for taste, not only for taste, but only for the nourishment of your body. So when you think about how can we get to the population, it's really educating them through the primary healthcare centers. That's where you really get them the most. But again, think about access as well.